This segment sponsored by Viking Psychiatry. It's time for another Mental Health Matters with Viking Psychiatry, and I'm so thrilled to be joined by Sean Goddard, the owner of Viking, because there's some exciting news happening in the treatment world of mental health. Hello, Sean.
Hi.
Welcome.
I need you to do a dance like you made Dr. Oyer that one time about this.
This is exciting.
It is. It really is.
Wow. Okay. So when you shared it, I was like, it kind of feels a little full circle because when we first started chatting on the show about your treatment options, we talked about Spravato a lot, and that's a great option, but there were stipulations that came before someone could have that treatment. And now it's categorized as monotherapy. Y'all are probably like, what does that mean? Well, Sean's going to break it down for us.
Yeah, you know, this is so exciting. It's really game-changing for psychiatric care. Spravato has been used successively. We have studies in excess of 6 years of Spravato being used successfully to treat treatment-resistant depression and acute suicidal ideations. But with that has always come the requirement that an individual has to be on an oral antidepressant in conjunction and even on it to get approved and then continue to be on it to be able to continue to be on Spravato. If you stop your antidepressant, you no longer get Spravato. Right. And that has been a restriction in care for a lot of people. And so this monotherapy indication, what that means is, guess what? You don't have to have an oral antidepressant anymore. You can get Spravato now in this game-changing treatment without having to take a pill every day. Yeah,
that's really great. I mean, because pills don't work for everyone. And I know that your practice really offers a more whole body approach so that there's alternatives to having to just utilize the medication in that way. And so that skips that process. So how does this improve the treatment of depression and that entire landscape?
Yeah, so you know, far too many times when I talk to clients, they talk about the antidepressant they're on and they talk about all the side effects that they have with it, right?
Yeah.
And people have struggled with side effects or have said, well, I'm not necessarily depressed, but I feel like a zombie. I don't feel like, maybe I'm not sad, but I'm also not happy. I don't get excited like I used to, right? But I guess this is what I need to be on, right? And so this is a huge change. If somebody has struggled with antidepressants before, has struggled with side effects, has tried multiple medications, right? And have finally said, you know what, I'm not taking antidepressants and I'm not going to be able to do anything else because I'm not willing to take antidepressants. This in many ways removes the leash, right? And that's what I think about is this leash around you that says you have to be on an antidepressant, you have to be taking medication. And this gives a sense of choice and freedom in the care that people are receiving. And not only for the client, but for me as a provider.
Yeah.
You know, there are so many times that I get frustrated saying, I'm sorry, you're not eligible because you're not willing to take a medication that causes all these negative things that cause sexual side effects or weight gain. And now you can get Spravato, which is a completely different approach to the treatment of depression and acute suicidal thoughts and not be locked down to all these side effects and having to get up and take a pill every morning. Because you know what? Sometimes getting up and taking that pill out and putting it in your mouth is almost as crippling as the disease itself, because it's a consistent reminder. People say, this means something's wrong with me. This means something's wrong with me. And I don't agree with that.
Yeah. Yeah, and so in case this is someone's first time hearing about Spravato, they're like, what is this treatment, right? So let's talk about that in a sense. And one big thing is that there are instant results, right? When they come into your office and they start it, they can feel the effect quicker than the time that it takes for them to acclimate to the medication. So break down Spravato for us.
Yeah, so Spravato is a game changer. It acts on a different receptor in the brain, what's called the NMDA receptor, and affects this neurotransmitter called glutamate. And I'm not going to get too excited. I could geek out for like 30 minutes about this, but it's a completely different pathway. We've been following serotonin, norepinephrine, dopamine pills for so long in psychiatry. It's the only way we've done it. And this is a completely different pathway that does cause significant improvement. We can see changes. The studies show us in as little as 24 hours. Now, can I guarantee that for everybody?
Right.
No, I'm not going to do that, right? But what I can say is the studies show us that there is a significant drop in overall depressive scores and the way people feel within those first 24 to 48 hours. And what we see is over a time period of 28 days, we continue to see that slope down and become more consistent in nature. And so typically when we look at treating in psychiatry, we don't tell people you're going to be able to see a difference potentially in as little as 24 hours.
Yeah.
We tell them start this medication and you're going to have to wait 4 weeks, 8 weeks, 12 weeks. And this provides an opportunity to not only see change right away, but to see a significant impact and change in that 28-day time period and moving forward. Whereas with those pills at 28 days, you might just beginning to see some of those positive benefits that could come with the medications.
Okay, that's so good. Okay, before I let you go, just list off maybe the top 3 things someone should consider if they're like, is Spravato right for me?
Is Spravato right for me? The top 3 things. I would say, are you looking for something new? Are you looking for a difference? And really, if somebody is lacking hope, finding hope in these new treatment options. And I think people are going to see that this pathway is a pathway that we're going to be moving forward with in psychiatry. So if they want change and they want change now, this is really something that could potentially provide that.
Yeah, and you offer consultations, so people can actually come in, talk to you, see if the treatment aligns, learn more about it by visiting your facilities?
Oh yeah, absolutely. We welcome people. We push to get people in that are looking at Spravato, that are struggling with treatment-resistant depression in right away so that we can evaluate them, make sure that they're appropriate, and our goal is to get people started within 7 days of being seen.
Yeah. Okay, awesome. I learned so much when I talked to you, Sean.
Thank you.
Thank you. And if you would like more information about Viking Psychiatry or would like to set up a consultation, we'll have their phone number, we'll have their website listed below. Give them a call, and I'll see you after the break. This segment sponsored by Viking Psychiatry.